Hello, everybody. I just got a random burst of inspiration for a quick live video. It might not be that quick because I'm a chatterbox and I have a lot of passion about a lot of things. So birth decisions. That's what we're gonna talk about right now. Before I gave birth, I was kind of an unexpected doula based on my Chinese medicine degree. My scope of practice includes initiating birth feelings, aka inducing labor, with Chinese medicine. It's a very different induction of labor with Chinese medicine. What we do is stimulate points that increase blood flow and descend qi. So the cool thing about holistic medicine, Chinese medicine, and other medicines that work with the body energies is they're not overhauling anything. What they're doing is I'm going to say strongly suggesting that the body ask in a certain way. I have done Chinese medicine to induce labor, and it not worked, period, quote unquote, because if baby's not ready, baby's not coming. Children come when they are ready. When a baby is at full term, what happens is their lungs fully develop, and when their lungs are fully developed, there will be a neurotransmitter, a hormone signal that goes to mama's brain that starts labor. So this whole process of labor induction is actually extremely unnecessary. For women. So I did an Instagram post about this a while back. Our birth culture suggests that a 40 weeks is normal. So it tripped me out when I was pregnant that they start the count of weeks from the first day of your last period. So the first day of your last period, you probably were not pregnant, right? Because you're bleeding as if you are having a period. You're most likely to get pregnant during ovulation, which is 2 weeks into your cycle. So when they give you your 40-week date, they are already predating it by 2 weeks. So really, when you're at 40 weeks, you're probably most likely at 38 weeks, which is ridiculous for them to call it 40. And they say there's reasons for that. Now, they say don't go past 44 weeks. In my opinion, and from what I know of the power dynamics of the Western medical industrial complex, what they aim to do is create a pathological situation in the maternal brain to think that there's something wrong, and then they usurp the power of your birthing existence. So my mother always told me that the birthing or the gestational period is 10 moons. So that's an indigenous understanding, right? 10 moons. It's not 40 weeks. It's 10 moons. So when did you get pregnant? Where was the moon? When do you think you conceived? And then about 10 moons afterwards, when is that? That will be your approximate due date. I have seen in my birth keeping world that babies usually come during full moons, new moons, and storms. I actually only know of a couple of women who've given birth in between there. Most of the time it's big full moons, new moons, and storms, or other kinds of crazy or crazy awesome astronomical occurrences. So that's really powerful to understand as far as your body goes. It's also really, really necessary, women, that we understand qualitonali, that we understand that our ancestors been doing this, okay? Been doing this. So it's only in the advent of OBGYN in the last few hundred years, mind you, or a couple hundred years, not even a few hundred years, like the end of the 1800s-ish, they started doing this. And mind you, OBGYN was began by a man named James Marion Sims, something like that. And he was kicked out of medical school for killing women with his surgeries. Without anesthesia, mostly on enslaved women, on black women. And the surgical paradigm of obstetrics in the United States of America is based on his work. He was a torturous human who there's if you look him up, something Marion Sims, I can't remember his first name, I think it's James. I always forget his name because to me he is a monster and I don't honor his legacy, and this is why I specifically don't get OBGYN anything. And I do believe that surgery can save lives, and I do know of one particular midwife personally who is trained in being able to surgically intervene. There have been surgeries all across antiquity. Look at the Egyptians and the mummification practices. Ancient China had surgical practices. The first recorded surgeon was a man named Watteau, and he was Chinese and used stone tools. So I don't want you to get it twisted that I don't believe in surgery. I just know that surgery, it was not always only commodified by a medical industrial complex that was set up in the United States of America for the profit of a few, with the price to pay of the bodies of many, and mostly black and brown bodies in this country. Even if you look today, black women have the highest mortality rate within the system, as well as black babies. So let's go ahead and talk about hospital births. It is only necessary to have an intervention statistically about 5% of the time for life and death situations. Right now, the cesarean section rate is upwards, I know it's above 30%, and in some places as much as high, like 55%. And there are also scheduled C-sections which bypass the hormonal needs of a woman's brain or of a baby's lungs formation to send a signal to the woman's brain to start labor. That says that the baby is fully gestated. So that when they come out, they will be fully formed and ready. Another thing about babies and birthing vaginally is that when they're squeezing through the birth canal, that's helping them push all of the fluids in their lungs. It's going to squeeze their body to help them release all the amniotic fluid from their baby body, so that they don't have different kinds of issues. It'll even if the baby pooped inside of you, called meconium, a lot of the times they'll take your baby away in the hospital saying that that's some kind of risk, which I'm not saying it isn't, but going through the vaginal canal will help the baby expel that from their lungs. And the vaginal flora, as well as the rectal flora of the birthing mother, helps to inoculate, yes, like a vaccination, but naturally inoculate the baby to all of these different bacteria, fecal bacteria, vaginal bacteria, human bacteria, in their mouths, in their noses, in their eyes, that will make it so that they don't get sick. So it's actually causing more than helping, it's hurting our babies not birthing vaginally, especially if you're not giving them that vaginal flora, to help them, to help their microbiomes become, to inoculate them with these bacteria, these healthy bacteria, so that they can live purposefully or live free of external invasions, inviting pathogenic influences from outside, because they don't have the natural inoculation from the mother's perineal area. So there's that. Now, so that takes us to Pitocin and inductions. In my opinion, in my medical opinion, in my experience as a birth keeper, Pitocin only creates problems. So the sooner you get induced, the sooner you receive medical interventions, the more medical interventions you will need, or rather you will be primed for. So what Pitocin is synthetic oxytocin. And synthetic oxytocin, it means to contract the womb, to begin contractions, because what contractions does starts pushing the baby down. I will say I'm down for Pitocin, as I needed some at the end of my birth, and because I was bleeding. So they shot me with Pitocin, and that didn't work because not everybody responds to Pitocin, right? So even if they do give you Pitocin in the hospital, your body might not respond to it. So then they shot me with Cytotec. There's another name for that. I can't remember, but that clamped my my uterus, so that I would stop bleeding. So there is a place for this, but not at the beginning of birth. I also do believe that had I had birth workers that were more trained in natural remedies for stopping bleeding, that would have worked. So my baby was asleep, and now he's not asleep, so he just started crying. So I'm gonna go get that little baby boy, and I will hit y'all up in a sec. Ciao.